Hello, hello, hello. Happy fall to everybody. Welcome back to another fantastic installment of NJCDC's The Loft. I am Kaya King, Chief of Staff for the New Jersey Department of Community Affairs, here to welcome you to another installment of our Community Conversation series. For folks that may not be aware, we are in, I think, full throttle. We're well over a year of episodes and collaboration between DCA and the NJCDC. You may not be able to tell, but I've kicked Bob off for today because we had a couple special guests for a very special episode that we think is going to be great for not just the residents of Paterson in this area, but across the state. And it's an issue and a prerogative, I think, of my colleagues and subject matter experts here today, and really of the Murphy administration, and that is working on lead prevention. So I'm super excited because we were able to politely pester a couple of our sister agencies to join us today. And I say that jokingly because these have been willing and incredible partners in the state's efforts to address lead prevention and making sure that we've got a historic and transformational shift of getting lead out of our homes and making sure that we're not having these challenges in our families and children. So I'm delighted. I want to get into some introductions, but I also want to make sure to just give some context, because if you're not in this world of lead prevention, you may not be aware of the significance of next week. And I know my folks here in the room, they've heard it time and tell all, but we are now at actually the 13th year of the International Lead Poisoning Prevention Week. That takes place annually. It's typically, I think, the last week of October. This year it is starting on the 19th through 25th. And the campaign focus, because I wanted to have that at the starting point, I think all of our, rock star experts here today are going to touch on this. But this year's campaign is about no safe level, acting now to end lead exposure. And it's really about a reminder as we get to this 13th year of making sure we're observing this and being proactive of the unacceptable risks of lead exposure and the need for action to protect children's health. I also wanted to give light to a bit of history, because folks may not know, even, in the US, we have made sure that there was a National Lead Poisoning Prevention Week starting in 1999. And I didn't realize this, but this had been a prerogative of the US Senate. They had passed a resolution. It was Senate Resolution 199. That ensured that we had an annual observance and a focus point from our state agencies to raise awareness, encourage preventative actions against lead poisoning. And since then, it's been held annually. And I suspect that that type of ritual and reminder has also helped us make sure this is at the forefront for funding and support as we get here to 2025 today. So I want to introduce the folks we've got here. We've made sure that we've got DCA in full representation. You're not going to hear all of my voice today, thankfully. We're going to have another one of my fantastic colleagues, Janel, tapping in. But we've also got folks from Department of Health and Department of Environmental Protection who've been great sister agencies and partners with us. So I want to first just introduce, we've got Janel Winter with us today. She's our Assistant Commissioner and Director of the Division of Housing and Community Resources at the DCA. You may have heard from some of Janel's fantastic staff in some of our prior episodes. She has a couple of things under her umbrella, and I'll get into that in a minute, but she's covering the work that we're seeing incredibly in affordable housing, homelessness prevention, and eviction prevention across the state, and then notwithstanding a little bit of lead on the side. But Janel has made sure that as the state's public housing authority, we have been able to serve successfully 40,000 households annually, provide home energy assistance programs serving more than 200,000 families, and making sure that we've got an active, and even in this climate today, affordable housing production program. Her work and leadership for the Office of Homelessness Prevention, Office of Eviction Prevention, weatherization, and obviously lead remediation and abatement programs has made sure that New Jersey has been a national standout in our efforts to support New Jersey families on all of these critical social support programs. She has also managed the distribution of more than $2 billion federal COVID-raised fund dollars to address rental and utility assistance arrears during a little thing called that pandemic, and made sure that we had continued community revitalization and development throughout the state. Prior to joining DCA, Janel led the Office of Housing at the New Jersey Department of Human Services, another one of our rockstar sister agencies, and served as Associate Director at the Corporation for Supportive Housing. Before returning to her home state of New Jersey, Janel worked at various direct service homelessness and housing agencies in Chicago. Janel, thank you for coming.
Thank you, Kyle.
Next up, we've got Dr. Novneet Sahu. I want to make sure I'm saying that correctly.
Sahu.
Thank you so much, Dr. Sahu. Good to see you again. And Dr. Sahu is the newest, I think, member of the Department of Health family, joining as the Deputy Commissioner over Public Health Services. Dr. Sahu is an experienced emergency and family medicine physician who has a rich history of service to community in both local and global health settings. He recently held the positions of Associate Professor of Emergency and Family Medicine and Director of Health System Science at Rutgers, New Jersey Medical School, and also served as an attending physician at University Hospital in Newark. Great hospital up there. Delightful that you were there to support them. Dr. Sahu has filled the role of state EMS medical director and special consultant in the Division of Disaster Preparedness, Resiliency, and Emergency Medical Services. Dr. Sahu grew up in Morris County, proud resident, and received his Doctor of Medicine from University of Medicine and Dentistry of New Jersey Medical School, and a Master's in Public Administration from Rutgers School of Public Affairs and Administration. Welcome. Thank you so much for being here, Doctor.
Thanks, Kai.
And then last but certainly not least, a familiar partner, someone that I've had the pleasure to work with over the last few years in this lead work together, Christine Schnell, Manager of the Office of Environmental and Public Health Analysis at the New Jersey Department of Environmental Protection. Christine is a 30-year veteran of the New Jersey DEP and currently manages the department's Office of Environmental and Public Health Analysis. Her program oversees complex data analyses and develops visualization tools designed to integrate environmental and public health concerns into local and state decision-making, planning, and the implementation of meaningful actions on a broad array of issues. That includes environmental justice, climate resilience, and sustainability. And I have to say, Christine, you and the team have made sure to be so transparent about that and that type of partnership with our DCA family as well as with Department of Health, and we appreciate that. Christine holds a Bachelor of Science in Environmental Science and a Master of Public Administration, another MPA in the house, both from Rutgers University. She is a certified public manager and a member of the Phi Alpha Alpha National Honor Society for Public Administration. Christine, welcome.
Thank you for having me.
So let's dive right in because I think a lot of the reason we wanted to get together is to really make sure that we were reminding people of how this issue, lead exposure, is still present, but that the state is clocking this and is at, I think, the greatest position than we've ever been in to try to get this out of the homes and bring an education and awareness to it. So I want to first set the stage with that a bit. So Dr. Sahu, lead poisoning prevention, as you, I know, are aptly aware, and I'm sure a lot of your colleagues are at Department of Health, this is a key public health priority for a number of decades. But this issue is still in existence, right? This is not new, new news, right? People have been hearing about this. There's active campaigns that have gone out for decades about this issue. Why is this still such an important focus for New Jersey today?
Thanks, Kaya. New Jersey has a unique combination of older housing, legacy infrastructure, and diverse cultural factors that all continue to be sources of lead exposure. Many homes in New Jersey were built before 1978 and still contain lead-based paint. Aging plumbing systems in some communities still include lead service lines, fixtures, lead solder. Environmental contamination remains from past industrial sites and historic pottery factories. Some imported spices, canned foods, toys, and cookware may also contain lead, and some cultural products such as traditional medicine, eye cosmetics, or sacred soils can also contain lead. Why this is important is that even low levels of lead can harm a child's brain development, learning, and behavior, effects that can last a lifetime. This is not just an old problem, it's a present one that intersects with housing, infrastructure, and environmental justice.
And I think it's really important to call back to those very specific examples of where lead is. And I'll talk about my own ignorance before I even came to the department and was aware of this issue. The prevalence of this still being in everyday products in our homes, right? We think, well, we're in current event, right? Nobody's putting lead in. And you still have this manufacturing reality and just the industry reality that there's a residual impact that we have to fetter out in a lot of different areas in our homes and in the products that we use every day. And we forget have these ties to lead exposure. And I want to turn a bit to you, Janel, because I think from DCA's perspective, right, on the housing end, when we're looking at housing quality, right, and even making sure we're meeting the demand for homes, we've also made a priority that those are healthy homes. And when we're looking at tying housing quality, and I think housing equity, right, to the public health outcomes that we're talking about, why do we need to make sure we're balancing equity in this conversation as much as the safety impact with lead exposure?
One of the things that we've said for a long time in the housing and community development world is that housing is healthcare. And I think that's really a call out to the fact that if you want families and communities to thrive, they need to live someplace where they feel safe and where they know where they can return there. If people don't have to worry about housing stability, if they don't have to worry about the quality of their home, then they can concentrate on other things. They can raise their children. Their children can concentrate on school. All sorts of things roll out from the place you live. And I think that makes a lot of intuitive sense, because where do all of us feel safest? Right. When we're in trouble, when we're feeling bad, when we're feeling good, we want to go home. And it's a really scary thing to think that your home might actually be something that could damage your children's health. And unfortunately, that's the case with a lot of older homes. And what we do see is that the homes that are more likely to have lead are both older homes, because it was legal then, but also homes that haven't been able to be kept up, that haven't been able to have a lot of maintenance spent on them because they're in poorer areas. And they might be occupied by people who have not had as much income. And so you do have things like peeling paint. You do have things where a child might touch something, put their hands in their mouth, as little children do, just a very natural thing, something you take a cute picture of.
Right.
But that could be something that actually leads to a child suffering what could be some lifelong effects from that. And I think it's really important. You can't see lead. That's one of the most difficult things, I think, for us in terms of dealing with this, is you could look around your house and you might see, if there's been a flood or something, you might see mold, and that's bad news.
Right.
You might see that, after a storm, your roof is starting to leak. That's bad news. You have to deal with that right away. But because you can't see lead, oftentimes people aren't even really aware of it until they're at the doctor's office being told that their child is tested positive, which is, terrible news to hear. And I think one of the things that's really important is making sure that all communities hear about the dangers of lead, hear about the ways that it can be present, but also know that we have resources that can help people. Because I think that's one of the fears too, is if you're struggling, but then you hear, hey, there's something wrong with my home, your mind instantly starts to race. Like, how do I take care of this? How much is this going to cost? Where do I find ways to do it? Who even does this?
Right.
Who do you call? Who's the, you call the plumber if there's a flood.
Right.
Who do you call if there's lead? And I think that's what the message we really want to get out, is that there are people to help you. There are people who do this all the time and are experts. And that's the programs that we've set up in partnership with the Department of Health, of Environmental Protection, to make sure people can get that service. And what we really want to stress for people right now in this week of lead prevention is the importance of prevention. I have a colleague who likes to say that we've unfortunately been using children as the canaries in the coal mine of lead poisoning. That when we really know we have to act is when a child has been affected. What we want to do with prevention is get out there earlier.
Right.
We know if a house is old, if it's pre-78, it more than likely has lead in it unless it's already been remediated or abated. And so one of the things we've learned at DCA is not to wait until a child is turning up as having been lead poisoned or having been affected, but to think, even if a child isn't living in this home right now, chances are one will.
Right.
If it's a rental, a different family will move in. If, it's a family and they say, well, my children have grown up. Well, what about when those children have grandchildren, have your grandchildren, and then they are going to come into your home? Let's get into all these homes and address this issue so that the next family to move in doesn't have to worry about it at all. And I think getting that message out and making sure that everyone understands that, and also understands that the risk is higher in areas where there is older housing stock, where there is housing stock that's had less investment, in neighborhoods where there's been less investment. And unfortunately, I think we know that in New Jersey, that has a history of tracking to neighborhoods that are often neighborhoods where poorer people live, where more vulnerable communities, where marginalized communities live. In addition to everything else, they also face housing that has a higher risk of lead. So we want to make sure that we spend a lot of time working on the homes and working with the families living in those areas so that we can make sure they benefit from these resources we have right now to address this issue.
And I really appreciate you kind of highlighting how not obvious it is, right? Because I think, and I'm a bit of a newer mom. I've got a 5-year-old, and the amount of things you've got to remember and recall, right, as you're juggling, and it's a bit of a double whammy, right? You have, I'm sure, that unfortunate day. You get that call from the doctor. The exposure's already there. To add insult to injury, you're like, okay, wait a second. Did this happen in the home? How did this happen? What do I need to do? And like you said, where do I even go? You don't get that, that kind of missive in the new parent manual of, for lead, it's this. And that's another reason I think why we're starting to get really loud about it, because we don't want it to get to that point where it's too late. And, you started to reference it a little bit, but I think the preventative theme and mantra that the department and all of our agencies are doing, I mean, a lot of this is that we're trying to really knock on the door and say, we're letting you know about this now, and we've got funding and support to help. But can you talk a little bit about our lead remediation and abatement program? Because I think that's been a star feature of what DCA has been able to do in the last few years, of literally getting into the homes to address, this risk for families.
So over the past few years, we've had a generational investment in funding to handle lead abatement and lead remediation in homes. Governor Murphy and the legislature have invested $180 million in these efforts. And what that's meant is that we've really been able to kind of kickstart the industry of people who can help address this. We've trained more than double the number of agencies that we had working on this issue over the last few years. So that means that in every county, in all communities, we have nonprofit groups who have been trained to assess homes to see if there is lead there, to look at what needs to be done, and to make sure that work gets done and managed. In addition, a lot of the concern people sometimes have about this is, how much will it cost? And that cost can be prohibitive. An abatement can cost $20,000 or more. That's not something that people usually just have laying around to take care of it. Mm-hmm. But the good news is, in those funds, we can take care of that cost. For families who are making up to about, our bureaucratic language for it is 80% of the area median income. Mm-hmm. But what that means for a lot of families is, you can be making 6 figures and still qualify for that in New Jersey. Mm-hmm. And I think we know that no dollar goes as far as it used to. So there are a lot of people who aren't sure, who wouldn't think that they would be eligible. Mm-hmm. And so one way really just to tell it is, if you are, is to go to the DCA website. One thing we've tried to make it easier to do is to look at all the benefits that you might be able to benefit from as a family. So at the same site, with the same application, you can apply for help with your utility bills, which now is a very good time to be thinking about that. You can apply for help with weatherization. So I myself live in an old house that had to be tested for lead. So I know right now that the drafts come in. Mm-hmm. The windows aren't as secure as they might be. That's a program we have that can help make that happen so that your utility bills will go down that way. You can also apply to see if your home qualifies, if it needs lead remediation or abatement. Mm-hmm. And one of the great things about doing that is you can have one of these agencies come in and check it both for weatherization and lead remediation and abatement. Mm-hmm. So that when you need to get these things addressed, you can get them addressed at the same time. So it becomes a very easy process where you provide a little information about your family, about, how much money you make, about where you live, And then when people are coming in to do this work on your home, it can all happen at once. And we have these agencies, these community-based organizations that manage the process. Again, if you've had to have anything fixed, I think you know that it can be a really difficult process to, you got to figure out the right person to call, you got to schedule them,
Right.
you got to make sure that they turn up, and then maybe they don't, or it's another day, or are they a good group to work with or not? That's why we have these community-based organizations involved, because they can manage that process. You can trust that they know who will be a good organization to do it. They know what the process will be. They can take care of this. And then they also test the home after the work has been done to make sure it's been done properly. And finally, once it's been done, you'll get a certificate that tells you that your home is now lead-free. And if you were a renter, that gives you peace of mind. If you're a homeowner, when you go to sell your home, that's a question people are going to ask you.
Right.
You know, it's more and more, it's become important. It's people are learning about it, so they want to know too. And so you'll be able to provide that certificate, and the next person coming in is not going to worry about that.
Right.
They'll know that their family is going to be safe there too. And so if you go to DCA's website, you can find all of this information. Mm-hmm. You can also find who the agency is in your area who takes care of this and how you can get in touch with them. And that's it. If you have trouble with the application, or if you're someone who, you know, doesn't really like to do things on a computer or even on your phone, we've optimized everything. You can do it all from your cell phone. Mm-hmm. But if you're not that comfortable with that, you can call this agency. And for people who are seniors or who are disabled, they have someone who can come out to your home and help you apply for these things, so that then you can apply. And if you're eligible, all of this gets taken care of, and you have a home that you can trust is going to be safe and warm in the winter and cool in the summer, and a great place for your family to live for, you know, for as long as you're going to live there.
Thank you. And I think it's so great that we've been trying to move in a direction of meeting people where they are. And I'm sure Janel's heard me or Commissioner say this once or twice. I think probably you all have heard that missive, right? As we're trying to really get out to families. And what's great about this program is whether you're a landlord, renter, homeowner, it's money out there. It's an investment, not just in health and safety, but in, you know, the value and sustainability of our housing stock, right? So it's a rare kind of win-win-win on that account, right?
I think that's a really important point too, because sometimes what we hear from renters is they're a little worried about, well, if I raise this to my landlord, is my landlord going to be mad at me?
Right.
Are they going to think about the cost? And landlords can apply for this too. And renters can apply for this too. And it's actually a benefit to your landlord.
Right.
Because once this is taken care of, then the next family that comes in doesn't need to worry about that. It adds to the value of that rental property. And also, New Jersey's passed a law that now requires even 1 to 4 unit rental properties to be tested for lead and to be certified, and to address that lead if it is there, to be certified as rent-free. And that's something a landlord would have to handle on their own if they don't take part in this program. So as a renter, you're not actually, you know, causing a problem for your landlord. You're fixing a problem for your landlord. So that's a great way you can collaborate with your landlord and make sure that the property is safe for your family, but then it also increases the value of the asset for your landlord too. So it really is a win-win.
Yeah. And I think, you know, you would kind of reckon back to this law. And I think that was a little bit of even how all of our agencies kind of reconvened together, right? In 2021, there was a substantive law passed that ensured that there was required inspections for, you know, rental dwellings and, you know, 1 and 2 family and multi-dwelling units. And that's a really critical piece, because there needed to be a little bit of teeth on that, some eyes, and a reminder point, I think, that went down to municipality level, right? Because there's a requirement on municipalities to make sure those inspections are being conducted, right? And DCA is taking a really intentional lead to support our towns on that effort. But if we didn't have that standard, I think, set a few years back, it wouldn't have incentivized to where we are now. And I think be a good motivator and a mutual win. Now, I also don't want to, you know, misstate the fact that, you know, we've been talking a bit about housing, and that's a critical exposure point. No one here is suggesting otherwise, but we all know, and thankfully through the science, through the you know, the medical research, that's not the only source for lead exposure for children and families. And so I want to make sure, and I think, Christine, you've made sure that you and the team are really putting the environmental links at the forefront. And so I wanted to hear from you a little bit, because we know that it's not necessarily just happening inside of the home, right? And I think DEP has tried to make sure to be a bit of a sounding box on the fact that there's environmental sources like soil, like water, like our air, that has this exposure. And I think that, and I didn't realize this, it's a naturally occurring concept, right, with lead. And so we're not just dealing with how we're making sure that exposure is eradicated in the homes, but what does that mean in terms of our environmental impact, and how can we work together to reduce that risk?
Yeah, absolutely. I wanted to start with air because air is actually a lead success story. So to your point that it's, zero sum here, there's no safe level. Lead is the only compound that is both a national ambient air quality standard, one of the 6 from Clean Air Act, and then it's also a hazardous air pollutant. So even then, they recognized the potential of this to impact children and families. The air concentrations dropped significantly with the phase out of leaded gasoline and the removal of lead from our consumer products like paints and other products. We haven't exceeded the lead standard since the early 1980s. And then we haven't gone over the health benchmarks since EPA started tracking in the 1990s. So that's a success story. I'm going to put a pin in that because while the air is good, there's some legacy that's going to come around from what we were burning and using at that time. But I'm going to switch a little bit to water.
Yes.
So the primary source of water is corrosion of older plumbing materials inside the homes and bringing water inside the homes, particularly the service lines that are transporting the water from the water main to your home. And that's not the only source, but that's the one that we're most concerned of. Same year, 2021, Governor Murphy signed legislation making sure that all community water systems replace those lead service lines by 2031. And we're well on our way, moving that forward through the water program. But to your point, again, this is a housing issue. It's older housing, it's older plumbing. So that's a double whammy for some of those people who are living in homes that are older.
Right.
And, it's not fun for me to be able to tell people that you're not safe in your homes. Your home is the problem. Mm-hmm. The amount of lead in your water is based a lot on the chemistry of your water, acidity, sciencey stuff, temperatures. But as we're moving through and replacing those lead service lines, it's important for people to realize that if you have lead service lines and you're not being replaced yet, a good filter will take the lead out. So you can do that in your home to make yourself safe. And really, if you just flush for like 30 seconds, it kind of takes out the water that's been laying in the lines in contact with that corroded lead. So it's important for people to take active protections of their families while the departments and state agencies are doing their thing to replace lead lines. And then the last one that we're going to talk about a little bit is soil. And now I'm going to tie it back to air. Mm-hmm. So our soils, lead is a contamination of concern for soils. Where is it coming from? Direct discharges, historic direct discharges, air deposition. So we haven't had it in the air for a while, but it comes down through what we've done in the past. In the rain, it's in the soil. And then also historic fill, which is we want all that level land to build our lovely developments. And so we truck in some kind of mixed batch of things that has a tendency to have high levels of lead in it. DEP recently, 2004, just updated their soil standards following the EPA guidance that was out. And we're kind of testing that through the site remediation program. That's mostly where that's coming in. You might have heard July of this year, the US EPA had a historic pottery site in Trenton added to the Superfund site. It's a wide section of Trenton. It's in the soil. They're also on lead service lines.
Right.
They're older homes. So here's a triple threat for the people who are living there. So it's real and it's happening. And, you know, we're doing the best that we can, but we're hoping that people are made aware so they can be self-active in protecting their children.
You know, and I think understanding where those exposure points is that first step, right? Because I think you can have a fear about it of saying, oh my goodness, right? It's sourced in this one location, but because it's naturally occurring, because we've got some historic precedent of where it's been used in our society and just really what is going to happen from a nature perspective, we've got to be pragmatic and transparent. This is where it is. And I think that's a good segue, Christine, because I think, you know, in terms of families who are listening, you know, to this, I think understanding where that exposure comes from, you know, inside the home, outside is key, and how in which I think our children are getting that exposure, right? What are some of those activities or the ways in which that can happen? And what are the signs, right? Because we're in a preventative phase, but we know that it's there. We know that it's a residual impact, and we're going to be juggling this for a while. And, you know, I want to ask you, Dr. Sahu, you know, what is some important considerations that parents and families need to have about that child exposure and their own exposure? And, you know, what are parents and caregivers, you know, needing to be mindful of or look out for to support families as we talk about the resources here?
Yeah, thanks. So I think children can be exposed to all the same kind of environments and things like that were mentioned. So like the peeling and chip paint in homes, the water that's pumped through lead service lines, the contaminated dust and soil that somehow makes its way into the home. You know, kids are also curious folks, right? And so like even things like imported cosmetics, spices, toys, things like that, often find their way of leaching lead into kids. And then also we have to think about some of the other stuff like we call it take home lead, right? So like, you know, parents' hobbies or where they're working, and then bringing lead into the home from those environments as well. Janel, I loved how you said housing is health, right? Because I think when I think about that, right, it's the things in the home itself, but also like, you know, all the things that come and interact with the home and interact with the kids in the home as well. I think the thing that parents really need to also be aware about is just like we can't see lead in the home, we really have a hard time being able to see the effects of lead in kids just by like, you know, observing their behavior and things like that. And so a lot of the symptoms are just general things like you might have a kid that has loss of appetite, maybe a little bit of poor growth, maybe feeling fatigued. But these are also things that are just not abnormal for kids to be doing anyway. As kids, you know, are in their early years from like 0 to 2 years old, you might start to see these things like developmental delays, some behavioral changes. And then, you know, as they hit their kind of preschool years is where you might start to see some like speech and language delays and learning and attention problems. But really the way to detect some of this is by getting tested. And in New Jersey, it's important that we test children at 1 year old and 2 years old. And if we can't do that, really, we're trying to do this as early as possible before they turn 6, because this is that critical developmental time period. And insurance covers these tests, and free testing is often available through the local health departments, especially for the uninsured and underinsured. And so, you know, I think when we think about like what to look for, yes, it's like being aware of all these sources, but also being aware that we're probably just not going to detect it by looking at the kid. We should make sure that we're actually doing testing as well.
I'm so glad that you emphasize that, and shout out to our local health departments. Yeah, we got to brag.
They're the
about
best.
They are the best.
Yes, they are awesome.
They are the best, because I think I number one, I've met a couple of just stars across the state that this isn't just a job. It's a social good, and it's really kind of a life's blood for our frontline workers and our health departments. And I'm so glad you mentioned just that concept of testing. And we're going to make sure that there's a lot of links and resources, right? Where you can go to get tested, where you can go to get this funding and resources for abatement and remediation. But I think that's so valuable to just know, hey, be preventative, safer than sorry, get your kid tested. And I think also just make sure that this is something that you're spreading information about, right? Because as a parent, you talk about all of these other exposure points, and I don't think lead comes up enough all the time, or sometimes stays in the memory, right? Until the symptoms start to, really manifest. And, I want to pivot a little bit, because I think, what you've highlighted, doctor, in terms of even the lead testing, the support from the local level, I think also that, parrots back to where the state is also trying to be very collaborative. And I think for many towns, right, there's been a force point of, we've got this issue, we've got to work together. And I think we all, as respective state agencies, are trying to plug in and figure out how we're coordinating. And so I like to start first with DOH, but how are you all kind of working on the coordination of efforts as we're working with communities? I'm going to make sure we're hearing from DCA and DEP, but from DOH's perspective, where have you all found the wins in that coordination effort?
Yeah, and so I'm going to just plug again the local health departments for a big thing, because yes. So we manage the public health surveillance, but this is in very, very close coordination with the local health departments to support things like screening, the environmental investigations, the nurse case management that happens once we identify a child or family with high lead levels. And then DOH also supports childhood lead partners. And I think it was mentioned before, a lot of the community based prevention organizations, but we also support 3 regional coalitions as well. And I think it's important that we mentioned it before, but like, we do all this in very close coordination with environmental protection, with DCA, with DHS, and a lot of other organizations as well, because there's a lot of intersections when it comes to lead.
Mm-hmm. Yeah. And I think, as we're talking about, health is a human right, homes being essential to health, tying in all of these industry partners and experts is, I think, the way that then it's going to get contagious, for lack of a better word, but in a good vein. From a DEP perspective, Christine, and I'm going to make a plug about the PLEM map, because I'm hoping you mentioned that too, but we've been seeing some great work come out of DEP for a number of years. And I want to share and have you give a little bit of like where that collaboration has kind of gotten us today, and what are some of the new things we're getting out together.
Yeah, definitely. We are definitely going to talk about PLEM. Yes. That's the potential lead exposure mapping tool. Very big success from the three agencies together. But he did want to kind of piggyback on what the doctor was saying in terms of it's not just these 3 agencies. We have an interagency task force on the prevention of lead poisoning run by the Department of Human Services. Our Department of Education and Child and Family are both heavily involved in the lead and water situation and testing in schools and daycares. So shout out to those other sister agencies that we're talking to.
Absolutely.
PLEM is a tool that we started in, I want to say 2022.
I think so. Right on the tail end.
Right. Yeah. For this week.
Yes.
Really started out, it's a Lego project, I like to say. So really started out as like one thing, which was age of housing, kind of binning that into the 3 different categories. You definitely have lead. You might have lead because the regulations weren't in place and you're newer, so you're probably safe. We put that out kind of to help DCA's inspection people kind of understand where they need to prioritize and where they need to go. We grew that every year for National Lead Prevention Week. So the second, 2003, DCA gave us some amazing new layers, one that shows the rental properties throughout the state, and one that kind of by county told you what the testing methodologies were. So those got added to that. Just this last year, we created a whole new web tab in it for water. And we were looking at the lead service line replacements at a community system level. So the tool keeps growing. We are, like you mentioned, we're in conversations with both your agencies to add new layers. So we're waiting to get that water data down to a parcel level so you could see the overlap between your home and the water replacement systems. And we're also looking to work with DCA on that inspection data that you guys are collecting. So yes, it has lead. No, it doesn't. Again, all to help the inspectors kind of prioritize and also educate the public so that they better understand. Because I think to your point, Doctor, that's another thing we're expecting the mom or the dad to know, right? So we had this conversation and I'm like, did they test my daughter for lead? Like, I don't know. So yeah, it's just one more thing we're expecting people who have 50 million things on their plates to understand they need to keep an eye on to protect their children.
Yeah. And thank you for, I think, highlighting some of the advancements that are coming out of it, because the goal of it was to make this accessible and be something. What I love about the tool is that the interactive nature, and every time we're getting in this layering and data, it's got more specificity. That means that if you are a parent and you're trying to figure out what's going on in my area, if you want to be able to get some supports and share and collaborate with some of these incredible partners in the nonprofit space and government space, you've got the data at your fingertips. Because how can we expect people to support and work on this exposure and eradication of lead if you don't know where it is, what it looks like, or how to get that information? And so I love that we're advancing this every day, I think, in terms of here's more data, here's the data that we've all housed as respective agencies, and we're gonna share it with each other. Because I think that's a bit of a mythology, right? That unfortunately folks think government is too siloed. We've always done it this way. I'm not saying that's completely untrue, but the folks in this room are trying to disrupt that. But I love that we're really saying, we're going to be smarter about this, and we're going to actually get more done when we're going to really share and be across that aisle. And Janel, I want to make sure to pivot as well, because Christine made a great point. Your team has been really intentional on that inspection side and making sure that we've made some accessibility for our municipalities, for inspectors, and really just people that are in this industry trying to get this remediation and abatement done. Can you speak to that as well?
I think Christine made a great point about the way in which historically it's fallen on kind of the parents to have to figure all of this out. And of course, usually when people are trying to figure it out is at a time of crisis. Right. Their child's tested positive. They're worried about that. They're trying to address that. And now here's another problem to solve. How do I actually take care of this? Is it in the water? Is it in my house? Is it in something inside my house?
Is it in my school?
Exactly. And historically, the way that government, not just in New Jersey, but all over, has handled things like this in all of its programs has essentially been each program has a lane, and you figure out what you need and you go to each lane. Right. And then you need something else, you go to a different lane. You go to a different lane. It can be a full-time job figuring out what programs there are that might help you and then applying for them all. Mm-hmm. So one of the things that we've been trying to do at DCA is change that culture. Because we share information, because we share policies and programs with our other agencies, we all know a lot about where someone might be at risk. We know a lot about, where we might see these effects the most. And so as we do this, we want to do two things. One is we want to be able to reach out proactively to households and say, hey, we think this might be something that you're affected by. So this program is right here. Here's how you do it. Here's how you apply for it. Call us up and we'll help you. So that even before a child's tested positive and someone is in that crisis mode, we're reaching out to them and saying, it looks like based on that map. That's a great resource for our community partners because they can reach out to people. Also, we want to make sure that as someone tests positive for lead, that our local health departments, that our pediatricians, that everyone knows that DCA has a program that can help people, so that you're not just giving someone bad news, but you're also saying, but also there's a way to help fix this. Like, so don't worry as much. Like, we want you to be focused on your child's health. We don't want you to be worrying about how you're going to deal with addressing this issue.
Right.
So we know, I think that, again, that kind of lane model, it kind of thinks about people in pieces. Mm-hmm. And historically, agencies have thought, well, I deal with the health piece. I don't deal with the house piece. Or we deal with the house piece. We don't deal with the, the human services piece. Right. Those are all separate. But I think what we've all learned, and I think what our state agencies are becoming really good at doing, is that that's not how people work.
Right.
We're all, even a house, you say it's a house, but is it the paint? Is it the water that comes in the house? Is it the dishes or the tools I have inside the house? Is it something in my backyard around my house? All of those things are, you can't separate them from each other. Just like you can't separate a person from their different parts and say, oh, that's your DHS part. That's your DOH part. Like, I'm the DCA part. Bring that part to me.
Right.
So the more we can reach out to people, and the more that we can also, when someone does come into one of us, not say, okay, well, try go and knock on that door, and maybe knock on that door, and there's probably some other door, but I don't know where it is. Mm-hmm. That we can say, like, hey, while you're here, let's do all of these things.
Right.
Let's make sure to look at all of the things, not just affecting lead, but also, if you have an older house, like, what's your utility bill look like? Mm-hmm. We all are hearing a lot about that recently. A lot of people need assistance. What other help do you need that we might be able to get to you while you're here, so that you don't have to go home and then think about, okay, now I got to fill out 15,000 different forms for all these different things, but I was just there. Why couldn't I do it there? And I think that's what, as a state, there's really been a push to do. And so the more we work together, the more we're able to say, when somebody comes into any one of us, hey, we have a lot of services in New Jersey. It's a great place for that. Let's wrap them around you so you get everything you need. Your family gets everything you need to really be able to thrive.
I love so many of those points that you've made and everyone's made on here, because I think it's a brutally honest statement, right? You can't compartmentalize a lived experience. And so, I think the challenge we have in government is we've got our budget lines and our program structures and regulations and things. But I think what we're discovering is that doesn't help us on the other end for the people factor, right? And making sure that we're delivering the public service. And so when we're deciding to say, how are we economizing all of these different resources, the blending of the funding that our respective agencies and our community nonprofits, where are we going to, capital stack and like bridge gap so that the funding, the services go farther, and we've got the least amount of duplicity or even, user headache. And Janel, I think this has been a pain point you and I have watched in the last several years. I think all of our agencies, right? We can have the best information, sources, money for this issue, but if it's too difficult for people to get through the process, we really didn't do our job, because they're not getting the help. And so I think we've been trying to, humble ourselves as government agencies and say, maybe we should, collaborate together a little bit, be intentional about the way in which we're going to come and be in the house once and give you a one-stop shop experience, right? Like almost being a bit more private sector about it, right? Here's a 360 way that you can get some support from your agencies. And I think that's where we're going to have some real staying power in it.
I think one of the biggest lessons that we've learned is that we really need to make sure that we're working with folks out in the community who are already working with the people that we want to reach. Those local public health departments, right. If there's a place where you go to get, your child vaccinated and them and they take good care of you and your child, well, that family's going to listen to that person. They don't know me, but they know that person. When we work with our nonprofit agencies, our community-based organizations, that's one of the big focuses that we have is Let's engage organizations that we know are out there working in the community already. I can teach you, well, not me, but my staff can teach you how to do lead remediation, how to see if someone's eligible. What's a lot harder to teach is how to make a connection with a family so that they trust you. And so that when they say, you should do this, this is a good idea, it's going to help you and your family, that they believe you.
Right.
That's the hardest part of this. And so I think we really have to look at that. I think one of the things that we've been doing at DCA relatively newly over the past couple of years is really trying to work with pediatricians. And that's a lesson that we learned from our partners at DOH. And it's a lesson that makes a lot of sense, right? When you think about it. Well, who knows when there's a child who might be impacted by lead? Well, their doctor. But because we're housers, because we're community development people, those pediatricians aren't our natural audience.
Right.
We don't really have reasons that we would go out and talk to pediatricians, and they certainly don't know who we are, because why would they?
Right.
So by working with, but they know who the Department of Health is. And so by working with the Department of Health, we can get our message out in front of them too, because no doctor likes to say, hey, your child is affected by lead, and you probably need to get your house checked out, and it's probably going to cost some money. So, good luck. What they'd much rather say is, here's a resource that will help you, so you should do it.
Right.
And it can help take care of this issue for you, and you won't be out of pocket. So the more we can get out and speak to them, and the more that we can be introduced to them by our partners who they know, the more they'll trust us too, and they'll be able to help us get that message out. And I think that's a big part of what all of our partnerships can do is we each have different audiences. We each have different folks who come to us all the time.
Right.
And we can help them learn about our different partners. And the other great thing about it is that it makes it more efficient, and it ultimately makes it more cost efficient. If we're duplicating each other's work all the time, then we're all paying for it 3 times. And with all of this, we're paying for it with taxpayer money, which is our own money.
Right.
And the families who are going to benefit, their money, all of that. I think even things as simple as we've started working a lot to make sure that all of our advertising around this, all of our awareness campaigns, we include each of our agencies in it.
Yes.
So that whatever door you come in to find out about it, or wherever you need help, the same message helps. Why do we need 3 different campaigns? We're all doing the same thing.
That's right.
Why do I need to learn to become a health expert? That's not going to happen. But luckily, I have a whole building full of health experts just down the street.
Yeah.
And the same with the environmental protection.
Right.
Once we work together on that, we have better service for the families that we're working with. It's a better service for taxpayers, and it helps us get the job done more quickly. So there's really there's nothing we lose by doing it.
Yeah. And I love the cross endorsement of industry and expertise, right? Because like you said, we're the housing community development folks, right? DOH, you all are, frontline in the healthcare space and in, healthcare equity, right? DEP is ensuring that we've got an environmental justice that we're rooting in from a lot of these different sources. But when we're leading that respective credibility and credence to each other, not only, I think, does it continue to legitimize and put this issue at the forefront, but it gives a comfort, I think, to people. They're kind of like, wait a second, okay, the state's talking about this, they're bannering. We can do that, right? And there's this trust, I think, that's getting built every day with those inroads. So I know that we're going to make sure to share a lot of resources out, but I think it would be valuable, especially with looking at this week and how important it is to give a call to action, right? Because we know that no level is safe. We've still got a lot of work in front of us. There's a commitment, I think, from the state, and leaving this on a positive note, that we're going to keep going for many years to come. But I think that we've got some real strategy and structure and some trust amongst our communities to know that we're going to work on this till it's done. But for those that want to take action, right? For those that are listening to this and are like, whether it be for themselves as parents or as renters, local officials, community advocates, right? Those in our school system, our healthcare workers. I want to hear from each of you. What would you share to be, I think, the most important step that folks can take a reminder of call to action, some resource from your agencies, or even an assumption that we want to disrupt to just leave our audience with today? And Dr. Sahu, I'll start with you.
Sure. Yeah. So I think I'm just going to reiterate that even very low levels of lead can cause serious harm, especially in children under the age of 6. And so I think the single most important step that I'd like to remind kind of all these groups is that we need to make sure that every child gets tested for lead, ideally at age 1 and again at age 2. And if for some reason that's not possible, this needs to get done before the age of 6. Early testing helps identify lead exposure before it causes serious harm. And I think it allows our families and our communities to take action quickly on things like education, support, lead remediation, case management. And so New Jersey Department of Health has this nice catchphrase that says stay lead free, test twice before the age of 3. And I think if all that you take away is that, I'll be happy.
I love a rhyme. I use that in most of my life, that and Post-it notes. So I'm glad we put that plug in there.
Yeah.
Christine.
So I will reiterate, test your children.
Yes.
That is a message, but also test your home.
Mm-hmm.
And take steps to reduce your exposure. So know if the older paints in your house are flaking, that's going to be an issue. Find out if your plumbing is lead. Lead service lines are being replaced. Do that research for yourself. Add filters if you think that you're being exposed to lead in that way, and do the flushing for 30 seconds. I can't say that enough. But also know your water. And that information is out there. Every one of the community systems is required to give you annual updates on what the water is like that you're receiving. And you can get that information through DEP's Water Watch if you wanted more details. And then the last thing is, even if you're on a private well, you could still have lead in homes, that the pipes that are coming in, or you could live close to an industrial site that is contaminating that. So again, annually test your water. You are your water supplier when you're a private well. So that's important.
Sage wisdom. And I think it's important, right? And it's coming from a lot of different angles. So you've got to keep those things in mind. But preventative testing. Jay, I'll let you end this with us.
So showing my age a little bit, but when I was in high school, there was a classic rock station out of Philly, I think. I was a South Jersey girl. And they used to have a Led Zeppelin hour. And they would say, it's time to get the lead out. And I think that's the big message that we have. It is time. And I think there's something really easy that you can do, which is you can go to DCA's website, or you can call your community-based agency. And if you don't know who that is, you can go to our website, or you can call 211, New Jersey 211, that can provide a lot of resources, and they can tell you. And either fill out an application or call that organization and say, can you come tell me if there's lead in my house? Mm-hmm. If you built your house last year, you're probably all right there. Mm-hmm. But if you say, even if you're not sure your house is pre-78, but it's old, you look around, you're like, this is an older house. You can do that. They can tell for you. Mm-hmm. That's what they're there for. That's what we want to do. And you don't have to wait. Even if you don't have kids living in your house right now, I think it should become something just like when you move into a new house or when you're looking for a new house, you think about if I want to have kids, where would the nursery be?
Right.
How would I do this? What do I need to take care of? I got a baby proof, all those things. That a part of it should just be, I really need to check and make sure that there's no lead in the paint. And it's something that can be taken care of very quickly. Mm-hmm. Remediation or even abatement, they come out, they do it very quickly. And then you don't have to worry about it ever again.
Right.
So it's something that just as simple as saying I'm just going to go to that website. I'm going to put my information in and let somebody come out and tell me if I need to do more. And if they tell me, hey, there actually is no lead here, well, great.
Right.
Then you have peace of mind. Mm-hmm. So I think that's something that's very easy to do to start the process. And then you're going to end it knowing that your home is healthy for you and your children. And that's a great place to be.
Perfectly stated. I think that knowing that the information is more readily available than ever. We've got so much resources. We've got a lot of support, a lot of free support, right? These are phone calls, and we're trying to even economize and make sure that the application is as painless as possible. And Jay, you made a plug for DCA. So we're going to make sure for this episode, we'll have a lot of helpful links for all of our agencies, DOH, DEP, DCA, for the respective programs. And again, if you get one of us, you're going to get all of us. And I think that's the message here today. So I want to thank our special guests, our subject matter experts, our leadership across the state that are answering this call, and that we're really in this fight together, but that we're making some progress. So we're going to take this theme for Lead Prevention Week and use it as a bit of a rallying cry. So I thank you all, and thank you to our listeners today. And we look forward to the next episode. We'll talk soon. Thanks, everybody.
Thanks.
Thanks for having us.